Hello everybody, I'm Dr. Yan Yu, founder of the Calgary Guide to Understanding Disease. For those that are new to the channel, welcome to the Calgary Guide Video Series. For those that are joining us again, welcome back. In this second video, we're going to be talking about what makes the Calgary Guide different, and I'm going to be walking you through the process of just what it takes to produce the Calgary Guide slides that you use and love. Before we get started, just a quick reminder that you can help support us in our work by liking the video right as the video is starting out, and also subscribing to my channel. Thanks so much. Let's get started. This video will be both for a general audience, which is of course our users, and also for the students and faculty who volunteer and work with us, for whom this video can serve as a training tool to help them in their role with the Calgary Guide. So to start off with, let me introduce you to the key components of the Calgary Guide team. Our team is composed of editors-in-chiefs, usually 3 a year, system editors, which are responsible for each of the systems like cardiology and respirology. We have authors, we have reviewers, we have translators, and the whole process is entirely run by volunteers. So we have students that author and review and translate. We have student editors-in-chiefs, we have student system editors, and it's all supported by faculty members who are licensed physicians at the university in Calgary, Alberta, Canada. Our publication process is also quite rigorous. To start off with, we generate a topic list based on whatever concept or whatever topic that the students find confusing. For example, if the students come across a list that's not explained, then that's a suitable topic for a Calgary Guide slide. Our topics are all listed in a resource internal to the organization known as the Calgary Guide Hub, which is a list of topics in all the different systems that we cover, which students who want to work for us can review and then can select the slide that they want to author. Once they select the topic, they then sit down and create the first draft of the slide based upon the guidance documents and the training documents that we provide these students. And then they submit it to peers for a first round of peer review. Now, these peers could include the system editor, or they could include other students who choose to be reviewers of slides as opposed to authors. Once the author applies the edits based on these reviewer feedback, the slide then goes to the editors-in-chief, who then provide a second round of review. Sometimes the editors-in-chief need to consult the faculty coordinator. I'm currently serving in that role, so that they can provide the most accurate and the most useful feedback to the student authors. The author then applies these edits based on the second round of revision, and then the slide goes to faculty, so licensed specialist physicians. Now, what's different about student review is that students will review the slide for formatting and also for ease of use, whereas having the slide reviewed by a faculty member, again a licensed physician, is so that we can make sure the content is as accurate as possible. In that way, we make sure not only the content is accurate, but also that the slide is suitable for use by a medical student or another healthcare learner. Once the third review is up, the author will make revisions based on the third review. The slide then goes back to the editors-in-chief. And then ultimately, if everybody's happy with the slide, it goes to the faculty lead, myself, for final review and online publication. Overall, I'd say the whole process can take at least 10 hours, if not more. Some slides have been reviewed even more times than the number of times listed here. We try to be fairly flexible here. If a slide is well made to start off with, according to our guidelines, then we may not need as many peer reviews. But if a slide has not met our rigorous guidelines, then we need to make sure the slide meets those guidelines in order to be published. Now, when we publish a slide, we don't just sit back and do nothing. We're constantly revising and updating the slides that we publish. The reason for this is, of course, because science changes, and we need to update the slides based on how the science changes. But the other reason is that sometimes we publish a slide, and when we look at it again, it doesn't really fit with our standards. And so we do have a process that students can use to be able to review and update slides that have already been published. Now, for the users of the Calgary Guide, here's a chance that you can fast forward. But I'll just quickly walk through the process for the students and faculty members who are involved in the Calgary Guide so that they can get a sense of the process. First, how do we know when to review a slide? Well, either the slide will be flagged for review based on specific concerns, and either myself, the faculty lead, or the student editors will do this. Or if a slide's date of publication is older than 5 years, that automatically triggers a review process. Any student who's keen to review published slides will be able to look through the Calgary Guide Hub, pick the slides that they want to review, and then sign up for the review just by writing their name in the appropriate column. The students, of course, will have received training in the Calgary Guide prior to reviewing any of our content, and if you haven't, please speak with our editor-in-chief for more training. The student reviewer then will edit the slide based on the slide review checklist, and I'll give you an idea of what that looks like in just a second. The student reviewer will then finish their work and submit the revised slide to the appropriate systems editor. Now, if the student reviewer is also a systems editor, then they will submit the slide to the appropriate editor-in-chief. Now, the editor will review the revised slide using, again, the slide review checklist, and also from their own experience. If significant content material was updated, for example, if a bit of medical information was updated or revised, or if new scientific understanding had come out regarding a pathophysiological process, then the editor will send the slide to the appropriate faculty member so that they can do an updated content review and make sure it's accurate. If the faculty reviewer makes significant suggestions, then the editor will work with the student reviewer to revise the slide as per the faculty member's recommendations. If the faculty reviewer makes no significant recommendations, or if the changes that the student reviewer did are largely related to formatting, or if the only content changes are wording related, then once the slide has been reviewed and approved by the editors can then send the slide to the faculty lead, myself. I'll give it a final look and update it online. I'll also update the hub to make sure that the slide becomes unflagged so that we don't duplicate work. Now, this is a slide review checklist that we use. For the general audience, you can trust the process in that we make sure that our content is as accurate as possible. We not only make sure that our explanations are clear and concise, we also make sure that our wording is as accurate as possible. For example, by writing things in the active rather than passive tense. We make sure that all jargon is well defined, and we don't have anything written that might be misleading or confusing. We also pay particular attention to missing steps, because often when we're explaining pathophysiological processes, sometimes the explanations are missing a key step that's required to our understanding. And we also make sure to explain these key steps in chronological order so that you can follow along to maximize your understanding. We also, of course, review slides for formatting. We pay particular attention to formatting, and we're very, dare I say, obsessive about it, because we want to make sure that our slides are easy to look at and easy to read and easy to use. And also, quite frankly, we want to make sure that our content is beautiful. And so we have a set font. We make sure to not include lists. We make sure to minimize our number of notes and abbreviations that we use. And we also just make sure in general that the flow of the flowchart is aesthetically pleasing and easy to follow. Now I'm going to walk you through an example of a slide review process using a slide that highlights all of the things that I just talked about: Achilles tendon rupture, pathogenesis, and clinical findings. You can see quickly off the bat that this first draft, even though that it was already published in 2014, can be improved. We note that some of the arrows, for example this one, and these ones, are either pointing in weird directions, or they're pointing in a counterintuitive direction from right to left instead of left to right. We also note that you have a box with an asterisk, and where does that lead? That leads to either here or here. We're not really sure. So we need to make sure that we write the actual process into the text boxes instead of just assuming that our readers know what abnormal biomechanics mean. For this box, as I already said, the arrows are pointing in a counterintuitive direction from right to left, as opposed to the more intuitive direction for a Western audience of left to right. This box contains notes. Now, for a student who is looking to try to learn medicine and going through this flowchart, the ideal is not for them to take their eyes off the flowchart process and look at a notes box and then go back to the flowchart and find their place. That just seems too cognitively cumbersome. Instead, we try to make sure that information in the notes section are either incorporated into the flowchart itself, or if they're irrelevant to the pathophysiological process, then we delete them. We eliminate unnecessary content on the slide. In this section, you can tell that we have a long list of clinical findings and complications. Now, none of these clinical findings and complications are actually explained by a pathophysiological process. So, for example, how does an Achilles tendon rupture, which affects the tendon, cause bruising, which affects the skin? And also, how does a tendon rupture lead to the creation of a sound? And how does a tendon rupture cause pain exactly? Finally, on this slide, there's also an abbreviations text box. Now, everybody uses abbreviations in different ways, and there's so many abbreviations in medicine. As new learners, it would likely benefit us more to be learning the actual medicine than to actually learn a new language of abbreviations. So what we try to do is we try to minimize the abbreviations that we use and to write the text of the abbreviations into the flowchart itself. On the next draft, this abbreviations text box will be gone. And we can see that now, so this is draft 2. So now this draft looks a little bit better. For example, you can see that the arrows are a little bit more fleshed out. They flow in a more intuitive direction, left to right and up to down. Of course, there's still something here. We'll talk about that later. And then, of course, there's some pathophysiology that explains each of the clinical findings now. So let's look closer. First, I just want to highlight the level of detail that we go into here. You can see that the size of the font of a title is not actually consistent. We use size 20 font for the main part of the title, and we use font size 18 for the other part. This is either not font size 18, or this is not font size 20, so that should be fixed. For this part, we try to condense the wording in our text boxes by replacing words such as increase or decrease with the up arrow or the down arrow respectively. For this part, we don't really need to know that Achilles tendon rupture is more common in men for the flow chart to make sense, or for the signs and symptoms of Achilles tendon rupture to be explained. So this text box can be eliminated. For this text box, when you read the text, it currently reads as Achilles tendon is weak and less flexible from irregular use. But you also note that this uses the passive voice instead of the active voice. You can see that the cause is put after the effect. So what we do, and this is what makes the editing process so painstaking, is that we make sure as much as possible to put the cause before the effect so that it makes chronological sense for the reader. So in this case, we would replace the text into something like irregular use causes the Achilles tendon to become weak and less flexible. See what a difference that makes? Now here, this is usually the place where we define the actual pathology. We don't really go into depth on diagnoses or diagnostic criteria in Calgary Guide slides. Again, we specifically focus on helping students explain why diseases manifest as they do. So diagnostic criteria are really outside the scope of the Calgary Guide. In this case, the unbolded text can be eliminated. Here, we continue to have the issue of signs and symptoms not explained by a preceding purple box mechanism. So that will be fixed. Here, you can see that two text boxes are redundant. Both of these text boxes deal with the pain or the feeling of what an Achilles tendon rupture feels like. They can be merged. That's the beauty of a flowchart format. Here, we have a complication leading to another complication, which always raises a red flag in my eye because if there's no mechanism, then how does a complication lead to another complication? So what we do here is that we notice in the second red text box, calf atrophy from decreased muscle use in chronic cases. Again, this is not only written in the passive voice, meaning the cause is put after the effect, but we have a mechanism that's hidden in this complication text box that should be written in its own separate purple text box. In this part, this is an issue of wording. You can read that currently it says gastrocnemius cannot contract to induce plantar flexion in Achilles tendon rupture. Now, some people might read this and go, it's not that the gastrocnemius cannot contract, but it's that contraction cannot have the desired effect on the Achilles tendon. So we would want to replace the wording here and not say something like the gastrocnemius cannot contract, because the first three words is factually incorrect. Finally, we have two green boxes in a row leading from one to the other. This is a red flag, just like I talked about with the red text boxes for complications. But once you read it, you can actually see that the second text box actually describes the first text box. And in that case, they can be merged. And of course, the word decrease can be replaced with a down arrow. So all of that said, this is the final slide that we've decided to publish. You can see that that extraneous text box about the epidemiology of Achilles tendon rupture has been taken out, that the causation process for Achilles tendon rupture has been clarified. Not only is the wording changed here, but also you can see that the boxes are arranged in a much more beautiful and aesthetically pleasing format. The arrows either run from up to down or symmetrically up to down if they're going off to the side, and they all lead down to one central text box here. The beauty of the flowchart format also allows us to add extra causative factors further along the causative process, such as here, going into this part of the causative chain, or here, when we describe the gastrocnemius muscle and what it normally does. You can see that we've condensed these previously 2 text boxes into one. We've also merged the 2 text boxes that describe the pain sensation of an Achilles tendon rupture. And finally, we've separated out the mechanism from the complication. And 7 years later, this Calgary Guide slide has finally been republished. Now, hopefully this video has demonstrated to you just how thorough a process we take in authoring and then reviewing and updating a Calgary Guide slide, so that whenever you're using a Calgary Guide slide, you can trust that you're using the most accurate information and that we're only presenting the information that you as a student needs to know. Nothing more, nothing less. That's all for today, everybody. Thank you for your attention and watching this video. And as a reminder, you can help support us in our work by liking this video and subscribing to my channel. See you in the next video.